Hello everyone. One of the most concerning risks is the potential for cognitive decline, including the onset of dementia. Seniors, who are already more vulnerable to dementia due to the natural aging process, are especially at risk when taking certain medications. Many commonly prescribed drugs have been linked to rapid cognitive decline, including memory loss, confusion, and difficulty concentrating, all of which can mimic or accelerate the symptoms of dementia. While medications are often necessary for improving quality of life, understanding the possible side effects, particularly the impact on cognitive function, is essential for making informed choices. In this video, we'll explore 9 widely used medications that have been associated with an increased risk of dementia and cognitive decline in older adults. By being aware of these risks, seniors and caregivers can take proactive steps to ensure that mental health is preserved alongside physical health. 1. Benzodiazepines, Xanax, Ativan, Valium. Benzodiazepines are among the most commonly prescribed drugs for anxiety, insomnia, and other conditions such as seizures. These medications, including Xanax, Ativan, and Valium, work by depressing the central nervous system, leading to relaxation and sedation. While they can be highly effective in the short term, the long-term use of benzodiazepines is a cause for concern, particularly in seniors. Research has consistently shown that the long-term use of benzodiazepines is associated with an increased risk of cognitive impairment, including memory loss and confusion. Seniors who take benzodiazepines regularly may experience a significant decline in their cognitive abilities. This is especially problematic since older adults often metabolize these drugs more slowly, leading to an accumulation of the medication in the body, which can intensify side effects. Furthermore, the risk of falls and accidents increases with the sedative effects of these drugs. Studies have also found that the use of benzodiazepines can accelerate the development of Alzheimer's disease and other forms of dementia. For seniors struggling with anxiety or sleep disorders, it is essential to consult with a healthcare provider about alternative treatments, such as cognitive behavioral therapy, that do not carry the same risks. 2. Anticholinergics, Benadryl, Atrovent, Elavil. Anticholinergic drugs are often prescribed for a wide range of conditions, from allergies to depression. These medications, including Benadryl, diphenhydramine, Atrovent, ipratropium, and Elavil, amitriptyline, work by blocking acetylcholine, a neurotransmitter that plays a crucial role in memory and learning. While anticholinergic medications can provide relief for various ailments, they come with significant cognitive risks, particularly for older adults. The use of anticholinergics, especially over the long term, has been linked to a heightened risk of dementia. Seniors who take these medications may experience confusion, memory impairment, and even delirium. The risk of cognitive decline is exacerbated when these drugs are used in combination with other medications that affect the brain. A large-scale study published in the Journal of the American Medical Association, JAMA, found a clear connection between long-term anticholinergic use and the development of dementia, particularly in those over 65. Due to these risks, seniors should carefully consider whether anticholinergic medications are necessary or if there are safer alternatives available. 3. Antipsychotics, Seroquel, Risperdal, olanzapine. Antipsychotic medications are typically used to treat conditions like schizophrenia, bipolar disorder, and severe depression. They are also sometimes prescribed off-label to manage behavioral symptoms in patients with dementia. However, these drugs, which include Seroquel, Risperdal, and olanzapine, come with a host of potential side effects, particularly for older adults. Studies have shown that the use of antipsychotics in older adults, especially those with dementia, can significantly impair cognitive function. These medications work by altering the balance of neurotransmitters in the brain, and while they may help control agitation or psychotic symptoms, they can lead to memory problems, confusion, and a general decline in cognitive abilities. The US Food and Drug Administration, FDA, has issued a black box warning regarding the use of antipsychotics in elderly patients with dementia due to the increased risk of death. Additionally, research has found that long-term use of these drugs can accelerate the progression of dementia, especially in those who are already experiencing early cognitive decline. 4. Opioids. OxyContin, Percocet, Vicodin. Opioids are often prescribed to manage moderate to severe pain, especially in patients recovering from surgery or dealing with chronic conditions like arthritis. These powerful medications, including OxyContin, Percocet, and Vicodin, are effective in pain management but come with significant risks, especially for seniors. One of the major risks of opioids is cognitive impairment. Opioids can cause drowsiness, confusion, and difficulty concentrating, all of which can worsen cognitive function in older adults. Additionally, long-term opioid use has been linked to an increased risk of dementia and accelerated cognitive decline. Seniors who take opioids are also more likely to experience memory problems, mood changes, and difficulty performing everyday tasks. The use of opioids in combination with other sedative medications, such as benzodiazepines, further increases the risk of cognitive decline. As the opioid epidemic continues to ravage communities, seniors must work with healthcare providers to explore non-opioid pain management options, such as physical therapy, acupuncture, or non-steroidal anti-inflammatory drugs, NSAIDs. 5. Sleeping pills, Ambien, Lunesta, Restoril. Many seniors struggle with sleep disorders like insomnia, and medications like Ambien, Lunesta, and Restoril are commonly prescribed to help improve sleep. While these medications can be effective in the short term, their long-term use poses significant risks for cognitive function. Sleeping pills can impair memory and cognition, leading to confusion, disorientation, and difficulty remembering simple tasks. Seniors who take these medications over extended periods may experience rapid cognitive decline, which can be mistaken for the early stages of dementia. Additionally, the sedative effects of sleeping pills increase the risk of falls, which is a major concern for older adults. Given these risks, seniors should consider non-pharmacological approaches to managing sleep, such as cognitive behavioral therapy for insomnia, CBTI, relaxation techniques, and establishing healthy sleep hygiene habits. 6. Statins, Lipitor, Zocor, Crestor. Statins are widely prescribed to lower cholesterol and reduce the risk of cardiovascular disease. While they are effective in preventing heart attacks and strokes, there is growing concern over their impact on cognitive function. Some studies suggest that statins, including Lipitor, Zocor, and Crestor, may cause memory loss and other cognitive issues in older adults. The exact relationship between statins and dementia is still unclear, but some research has found that statins may impair cognitive function in certain individuals, especially those with pre-existing cognitive decline. Statins may affect the brain's ability to produce cholesterol, which is essential for maintaining healthy brain cells and neurotransmitter function. While the overall risk of dementia from statins is still debated, seniors who experience memory problems while on these medications should discuss alternative treatment options with their healthcare provider, such as lifestyle changes or dietary modifications to manage cholesterol levels. 7. Corticosteroids, prednisone, dexamethasone. Corticosteroids are powerful anti-inflammatory drugs used to treat conditions like arthritis, asthma, and autoimmune diseases. While they are effective at reducing inflammation and controlling symptoms, their long-term use can have negative effects on the brain. Corticosteroids have been linked to memory problems, mood swings, and cognitive impairment, particularly when used at high doses or over extended periods. The cognitive effects of corticosteroids are often overlooked, but seniors taking these medications may experience confusion, difficulty concentrating, and a general decline in cognitive abilities. If corticosteroids are necessary for managing a chronic condition, seniors should work closely with their healthcare providers to minimize their dosage or explore alternative treatments to reduce the risk of cognitive decline. 8. Blood pressure medications, beta blockers, diuretics, ACE inhibitors. Managing high blood pressure is a critical concern for seniors, as it reduces the risk of heart disease and stroke. However, certain blood pressure medications, including beta blockers, diuretics, and ACE inhibitors, have been linked to cognitive side effects. While these medications are necessary for controlling blood pressure, some research suggests they may have a negative impact on memory and cognitive function in older adults. Although the evidence linking blood pressure medications to dementia is less clear than with some other drug classes, seniors who experience memory issues or cognitive decline while on these medications should speak with their healthcare provider to discuss possible alternatives. 9. Antidepressants, Prozac, Zoloft, Paxil. Antidepressants, including SSRIs, selective serotonin reuptake inhibitors, such as Prozac, Zoloft, and Paxil, are commonly prescribed to seniors dealing with depression, anxiety, or other mood disorders. While these medications can improve mood and help manage mental health conditions, there is growing concern about their potential cognitive side effects. Seniors taking antidepressants may experience memory problems, difficulty concentrating, and cognitive impairment, especially with long-term use. Tricyclic antidepressants, TCAs, an older class of antidepressants, are particularly associated with cognitive decline and increased risk of dementia. Seniors should work with their healthcare providers to monitor cognitive function while taking antidepressants and discuss non-medication treatments for depression, such as therapy, exercise, and social engagement. The risk of dementia is a significant concern for seniors, and many medications commonly prescribed to older adults can exacerbate cognitive decline. It's essential to be aware of the medications you are taking and how they might impact your cognitive health. Regular consultations with healthcare providers, seeking alternatives when possible, and monitoring cognitive function can help mitigate the risks associated with these drugs. By understanding the potential side effects of commonly prescribed medications, seniors can make more informed decisions about their health and well-being. Always consult your healthcare provider before making changes to your medication regimen. But armed with this knowledge, you can work together to find the safest treatment options that protect both your physical and cognitive health.